Duloxetine Hcl is a medication that is used to treat depression and anxiety. It is also used to help relieve nerve pain in people with diabetes or ongoing pain due to medical conditions such as arthritis, chronic back pain, or fibromyalgia. This medication may improve your mood, sleep, appetite, and energy level, and decrease nervousness. It can also decrease pain due to certain medical conditions. Duloxetine Hcl is known as a serotonin-norepinephrine reuptake inhibitor, SNRI, and works by helping to restore the balance of certain natural substances in the brain. It is important to take Duloxetine Hcl as directed by your doctor and to discuss any concerns or questions with them. Before you start taking duloxetine, it's important to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually 1 or 2 times a day with or without food. If you have nausea, it may help to take this drug with food. Swallow the capsule whole. Do not crush or chew the capsule or mix the contents with food or liquid. Doing so can release all of the drug at once, increasing the risk of side effects. The dosage is based on your age, medical condition, and response to treatment. To reduce your risk of side effects, your doctor may direct you to start this medication at a low dose and gradually increase your dose. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Also, you may experience symptoms such as dizziness, confusion, mood swings, headache, tiredness, diarrhea, sleep changes, and brief feelings similar to electric shock. Your dose may need to be gradually decreased to reduce side effects. Report any new or worsening symptoms right away. Tell your doctor if your condition lasts or gets worse. Common side effects of Duloxetine Hcl may include nausea, dry mouth, constipation, loss of appetite, tiredness, drowsiness, or increased sweating. Dizziness or lightheadedness may also occur, especially when you first start or increase your dose of this drug. To reduce the risk of dizziness, lightheadedness, or falling, get up slowly when rising from a sitting or lying position. This medication may also raise your blood pressure, so it's important to check your blood pressure regularly and tell your doctor if the results are high. Remember that the benefit of taking this medication is greater than the risk of side effects for most people. Some serious side effects to watch out for include confusion, easy bleeding/bruising, decreased interest in sex, changes in sexual ability, muscle cramps/weakness, shaking, difficulty urinating, signs of liver problems, black stools, vomit that looks like coffee grounds, seizure, eye pain/swelling/redness, widened pupils, vision changes, and serotonin syndrome/toxicity. It's important to get medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, trouble breathing, skin blisters, or mouth sores. If you experience any other effects not listed, contact your doctor or pharmacist. Remember to consult your doctor or pharmacist about any drug interactions and to report any side effects to your healthcare provider. When it comes to antidepressant medications like Duloxetine Hcl, it's important to understand that they are used to treat conditions such as depression and other mental or mood disorders. These medications can also help prevent suicidal thoughts and provide other important benefits. However, it's crucial to be aware that a small number of people, especially those younger than 25, may experience worsening depression or other mental/mood symptoms when taking antidepressants. It's important to talk to your doctor about the risks and benefits of taking this medication, especially if you are younger than 25, even if you are not being treated for a mental or mood condition. If you are taking Duloxetine Hcl, it's important to be on the lookout for any worsening depression or other psychiatric conditions, unusual behavior changes, or new or worsening mental/mood changes such as anxiety, panic attacks, trouble sleeping, irritability, hostility, impulsive actions, severe restlessness, or very rapid speech. This is especially important when starting a new antidepressant or when the dose is changed. As for the daily dosage and optimal timing, always follow your doctor's instructions. It's best to take Duloxetine Hcl at the same time every day to help you remember. And if you have any concerns or notice any changes, always talk to your doctor right away. Before taking duloxetine, it's important to talk to your doctor about any allergies you may have, as well as any medical history of psychiatric disorders, suicide attempts, glaucoma, high blood pressure, kidney disease, liver disease, seizure disorder, stomach problems, or alcohol use/abuse. Be cautious when using this medication, as it may cause dizziness or drowsiness. Avoid alcohol or marijuana while taking duloxetine, and be careful when operating machinery or driving. If you have diabetes, duloxetine may affect your blood sugar, so be sure to regularly check your levels and consult with your doctor. Older adults may be more sensitive to the side effects of this drug, particularly in terms of bleeding, dizziness, lightheadedness, or loss of coordination. Children may also be more sensitive to certain side effects like loss of appetite and weight loss, so it's important to monitor their weight and height. If you are pregnant or planning on becoming pregnant, discuss the risks and benefits of using duloxetine with your doctor. Additionally, this drug passes into breast milk and may have negative effects on a nursing infant, so consult your doctor before breastfeeding. And remember, if you have any mental or mood problems, do not stop taking this medication unless directed by your doctor. When taking duloxetine, there are some things you need to be aware of. The medication can interact with other drugs, affecting how they work in your body. For example, it may interact with drugs that can cause bleeding, such as NSAIDs and blood thinners. Other medications can also affect the removal of duloxetine from your body, which may impact its effectiveness. It's important to talk to your doctor about all the products you use, including prescription and non-prescription drugs, as well as herbal products. Additionally, taking MAO inhibitors with duloxetine can cause a serious and possibly fatal drug interaction. It's crucial to avoid taking MAO inhibitors during treatment with this medication and to consult with your doctor about when to start or stop taking it. The risk of serotonin syndrome/toxicity may also increase if you are taking other drugs that increase serotonin, such as certain antidepressants and street drugs like MDMA. It's important to tell your doctor if you are taking other products that cause drowsiness, including alcohol, marijuana, and certain medications for sleep or anxiety. Furthermore, using aspirin with duloxetine may increase the risk of bleeding, so it's essential to follow your doctor's instructions if you are taking low-dose aspirin for heart attack or stroke prevention. Always check with your doctor or pharmacist before starting or stopping any medication while on duloxetine. If you or someone you know has overdosed on Duloxetine Hcl and is experiencing serious symptoms such as passing out or trouble breathing, it is important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include severe drowsiness and fainting. It's important not to share Duloxetine Hcl with others. While taking this medication, you may need to undergo lab and medical tests to monitor your blood pressure and liver function. Make sure to attend all your medical and lab appointments to ensure the safe and effective use of this medication. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed dose and take the next one at your regular time. Don't take double the dose to make up for the missed one. Keep your Duloxetine Hcl medication at room temperature, away from light and moisture. Make sure to store it in a safe place, away from the reach of children and pets. When it's expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.